Assalamu alaikum wa rahmatullahi wa barakatuh. I am Dr. Muhammad Mustafa, Infection Control Director. We will speak today about standard precautions. Our agenda today: introduction, definition of standard precaution, component of standard precaution, and aseptic technique. At the end, learning moments. Infection control basics. There are two types of recommended precaution to prevent spread of the infection. Number one, standard precaution. Number two, the transmission-based precaution. Standard precautions are precautions applied to all patients. We made standard precaution from the start to prevent blood-borne pathogen. It is not accepted to found that patient suffering from hepatitis B or hepatitis C or HIV, and you describe in the patient chart hepatitis B precaution. That's not right. Okay, from the start, standard precaution applied for blood-borne pathogen, hepatitis B, hepatitis C, HIV. What is the component of the standard precaution? Number one, hand hygiene. Number two, use of personal protective equipment or PPE. Number three, respiratory etiquette or respiratory hygiene or cough etiquette. Number four, sharp and waste management. Number five, safe injection practices. Number six, sterile instrument and devices that consider CSSD. Number seven, clean and disinfection of the environmental surfaces. Number eight, ensure appropriate patient placement. Number nine, handle textile and laundry carefully. Number 10, wear a surgical mask when performing lumbar puncture. Hand hygiene. Hand hygiene is the most important measure to prevent the spread of the infection among patient and healthcare personnel. It can prevent alone about 90% of the infection in the hospital. I need from you to know, number one, the 5 moments of hand hygiene. Okay, the surveyor will ask you what is the 5 moments for hand hygiene. He will ask you about what is the meaning of hand hygiene. He will ask you about what is better, hand rub or hand wash. He will take care of issue related to your hands. Number one, the 5 moments for hand hygiene. They are 2 before and 3 after. Number one, before touching a patient. Number two, before clean or septic technique. Number three, after body fluid exposure. Number four, after touching patient. Number five, after touching patient surrounding. What is the difference between after touching patient or after touching patient surrounding? After touching patient, from the start, I will touch the patient. For example, I will take the vital signs for the patient, and then I will touch the infusion pump. That's considered after touching the patient. After touching patient surrounding, from the start, I will not touch the patient. Okay, the nurse came to the patient room only to adjust the infusion pump or to adjust ventilator parameters. This is considered after touching patient surroundings. Okay. Now, what is the meaning of hand hygiene? Hand hygiene is a major terminology describing one of issues, either hand rub or hand wash or surgical antisepsis for hands. What is better, hand rub or hand wash? Hand rub is better than hand wash. Why? Because it takes short time, it takes from 20 to 30 seconds, it kills microorganisms, it is easily accessible. But hand wash takes a long time, it takes from about 40 to 60 seconds, and it is not easily accessible, and it requires more supplies. You need source for hot and cold water, it need tissues for dryness, and it need a drain for the used water. Okay, all these issues compromise as accessibility for hand wash. But in certain situations, you should use hand wash. Like what? Like Clostridium difficile. Clostridium difficile is a major cause for antibiotic-associated diarrhea in the hospitals. Okay, the techniques we will take care about the steps and the count. Okay, the surveyor, when we ask you, can you do hand hygiene? He observe your steps and the count to calculate the time in his mind. Okay, number one, we do by palm to palm, then palm to dorsum for the right hand, then palm to dorsum for the other hand, then interlacing, then interlocking, then thumb in a rotational movement, then the fingertips. Okay, that's considered for hand rub. What about hand wash? It is the same steps, but from the start, I will get my hands wet, then take amount of soap. Number three, palm to palm in a rotational movement and the same steps, and at the end wash your hands with water to remove all soap from your hands, then take tissue to dry your hand and close the faucet if it is not without sensor. Now your hands are safe. The key hand hygiene. Perform hand hygiene when hands are visibly soiled. We are speaking about hand hygiene, okay, either hand rub or hand wash. When hands are visibly soiled, after touching instrument or equipment or material, before and after treating each patient, and before putting gloves, and again after removing the gloves. Use soap and water. This is meaning hand wash when hands are visibly soiled with blood or any body fluids, or when dealing with patient infected with spore-forming organism like Clostridium difficile, because the alcohol is not sporicidal, okay, and when the hands are wet because it's making dilution for the concentration of the alcohol used. We need more concern about no nail polish or artificial nail, okay. And we need smooth rounded nails. That is, this issue will be observed by the surveyor. The second issue in the standard precaution are the personal protective equipment, or PPE. The PPE we protect our hands by gloves, we protect our clothes by gown, we protect our mouth and nose by mask, we protect our eyes by eye goggles or face shield. That is the most important PPE you should know. Okay, all PPE protect patient and protect healthcare worker. Provide both protection for the patient and for the healthcare worker. The most important issue I need you to know is the order of donning and the order of doffing and the correct PPE you should use. We'll speak now about sequence of donning of PPE. Now I am dealing with patient with droplet precaution or airborne isolation. Okay, now what is the PPE I should wear? I should wear gown, I should wear mask, I should wear eye protection either by goggle or face shield, and I should wear gloves. What is the order of doffing? What is the order of donning? The order of donning, number one, wear the gown. The gown should cover from the neck to the knee, and it should be with long sleeves with elastics. Okay, the mask or the respirator, it should be cover the mouth and the nose. If it is N95 in the case of airborne isolation patient, it should be the same size of your fit test. Okay, and it should be adapted to the face. Now, number three, goggle or face shield. It depends on the procedure. What is better, goggle or face shield? It depends on the procedure and depends on the more adaptation of the healthcare personnel. What about gloves? The gloves should cover the elastics of the gown. Okay, now I want to remove. We will start by removing the gloves, then doing hand hygiene. Number two, removing the goggle or the face shield from the back or from the ear loops and discarding. Okay, number three, gown. We should start from the ties and the neck and the waist, removing or unfastening the tie, and then peel the gown and discard it in one line and in the general waste or infectious according to the case. Number four, the mask. All PPE should be removed in the patient room except N95. Okay, all PPE should be removed in the patient room except N95. Don't forget to wash your hands after each step in the removing of PPE. It is important for you to know that you should use PPE of suitable size, no over big or over small. Use gloves in situation involving possible contact with the body fluids or blood or mucous membrane or in non-intact skin. Use protective clothing to protect skin and clothing during procedure of activity when contact with blood or body fluid. Use mouth and nose and eye protection during procedures that likely to generate splashes or sprays of blood and other body fluids. Limited surface touches, removing PPE when leaving work area, and perform hand hygiene after PPE removal. Okay, number three, the respiratory hygiene or cough etiquette. All issues related to respiratory hygiene and cough etiquette can be concluded in three words. Number one, cover. Number two, use of tissue to contain. Number three, hand hygiene. Cover, that's consider what, or that's meaning what? Cover your mouth and nose during coughing or sneezing. Buy tissue if it is not available, use your elbow. Number 2, use tissue to contain your secretions. Okay. Number 3, do hand hygiene. Sharp management or sharp safety. Dispose sharp in the sharp container, which is a rigid plastic container made from puncture-resistant material, and fill it until 3/4 or until there is odor. Okay, we can found that new instrument which using engineering control, which prevent needle stick, and it can recap all this issue. Can improve the sharp disposal and decrease the needle stick injury. But the most important issue is discarding, no recapping. Okay, discarding it once it is used. Okay, once it is used and you finish, discard it. Aseptic technique. The surveyor will ask you about a lot of issues related to aseptic technique, and he will observe issue related to aseptic technique. What is the issue he will ask? He will ask you the peripheral venous catheter. Okay, it should be secure, properly fixed, and contains the time, and should be labeled with date and time for insertion and date and time for changing dressing. Okay, when we replace it in adult, it should be replaced every 72 to 96 hours. In children, it should be replaced only when clinically indicated. Okay, what about insulin pen? He will speak about insulin pen regarding what? He need to ask you multi-dose vial for a specific patient. It should be indicated and dedicated for one patient. Okay, and he will review your file. This patient is still here or discharged. Okay, the self-seal rubber cap for the medication vial. What is the material used for clinic and infection about it? What is the infection control measure regarding use of multi-dose vial? Okay, or vial in general. He will ask you to ask about. He need to hear that I need to disinfect the insertion site with alcohol swab and wait until complete dryness. Okay, that take about 30 seconds. Okay, IV set including secondary set that are continually used to infuse crystalloid solution. It can be replaced every 7 days for continuous feeding. Okay, if it is not for continuous feeding, it will be replaced or should be discarded by the end of the solution. What about IV set used for blood or blood product? It should be replaced for continuous feeding within 24 hours. If it is interrupted, it should be discarded by the end of the fluid. Okay. What about urinary catheter? He will ask you who will insert the urinary catheter. Okay, the answer it will be the doctor. Okay, what is the equipment used during insertion for the catheter? Okay, I need 2 gloves, one sterile for insertion and one clean for disinfection for the insertion site. The insertion site should be disinfected for male in a circular manner from inner to outer, in female in a parallel technique from up to down. That's considered what? From less contaminated area to more contaminated area. Okay, we use the clean gloves for disinfection of this area. Then I remove the clean gloves, and I wear sterile gloves for the insertion of the urinary catheter. The urinary catheter should be fixed to the patient thigh, and it should be placed and the urine bag should be placed below the patient the bladder level. Okay. What about safe injection practice? Safe injection practice meaning it should be safe for the patient, safe for healthcare worker, and safe for the environment. How it will be safe for the patient? Okay. Number 1, use sterile instrument, single-use device. Disinfection for the insertion site in a circular manner or in a parallel technique. Circular manner from inner to outer, parallel technique from medial to lateral. That's considered safe injection for the patient. What about safe injection for the healthcare worker? Once you finish the procedure, discard the sharp items without recapping. Don't recap. How it will be safe for the environment? Discard in a sharp container, which is puncture resistant container, and secure it when it is 3/4 or when there is odor, and that's the securing for the sharp container is the responsibility of the nurse. What about CSSD? Patient care items are categorized as critical, semi-critical, and non-critical. What is the non-critical instrument? Non-critical instrument, it is items which come in contact with intact skin. Okay, like pressure cuff. Okay, how can I disinfect it? I disinfect by alcohol swab after each use. Okay, if it's contaminated with blood or any other body fluid, we should discard it. We should clean it by water and soap, then disinfect it with alcohol swab. What about semi-critical items? Semi-critical items are items which come in contact with intact mucous membrane or non-intact skin. Give me example. Okay, the endoscope. This instrument requires at least high-level disinfection or sterilization. What about critical items? Critical care items, such as items which come in contact with non-intact mucous membrane or penetrate to sterile fluids, sterile areas. For example, the dental instrument. Okay, you will tell me that dental instruments are mucous membrane, but it is not intact. Give me one person who have healthy gum. Okay, we will not found two more. Okay, sterilization monitor. That's all items related to all these items related to CSSD. Okay, that's the biological indicator and the mechanical parameters for monitoring the cycle for sterilization and the chemical indicators. Okay, what is my responsibility regarding as an end user for CSSD instrument? Number one, I should inspect before opening, and if the instrument if the package is wet. Okay, if it's torn, if it's punctured, I will check the chemical indicator, it's pass or not pass. I will check the instrument inside the bag, it is clean or not clean. All these items are responsibility for the end users to check. What types of waste do we have? We have until now 4 types of waste. Number one, general waste. Okay, containing all waste or the ordinary waste and the non-infectious waste. Okay, we have pathological waste, which is discarded in the red container, like pathological waste, like body parts, placenta. All these are put in the red bag. We have infectious waste, which are the BBE and the dressing, which is contaminated with blood or all items contaminated with or soaked with blood or body fluids, or BBE from high serious diseases like measles, suspected or confirmed cases of monkeypox or TB, pulmonary TB, and items which is sharps should be discarded in sharp container. We have 5 types of waste, which will be inshallah in the oncology unit, which is cytotoxic waste. Okay, biohazard spill kit. If any blood spill occur in your area, you should categorize it into minor spill or major spill. The minor spill, which is less than 10 millimeter of blood. Okay, the major, which is more than 10 millimeter of blood. How can I deal with the minor spill? Number one, absorb by a tissue. Okay, then use water and soap to clean. Then we will make normal environmental cleaning. What about the major? If I found major spill, I should bring the biohazard spill kit. The biohazard spill kit, like which have in our photo, containing that is the powder or the absorbing granules or absorbing powder. That is a container for chlorine tablet. This one used for the solution of the chlorine tablet, and that is the scope. That is all BBE we should need. That is a biohazard or infectious bag, and that is a sticker for labeling of the infectious waste. Okay, what is the steps? Number one, I should put the caution board to decrease the movement in the area. That's consider first step for containing the secretion. Number two, I should wear all my BBE. Number three, we will put the absorbing granules to contain the secretion. We should put it from inner to outer from outer to inner, okay. Then during it take about 2 minutes to for complete setting of the granules. During this time, I will remove my PPE and I remove my gloves and put about from 5 to 7 tablets from the chlorine into the container for the water, okay, and waiting for about 2 minutes to complete solving of the chlorine tablets. During this time, there will be complete setting or complete dryness for the absorbing granules. I will collect them by scoop, then discarding it in the infectious waste and removing my PPE. I then pour the chlorine tablets. Both the chlorine solution now, the freshly prepared chlorine solution, okay, and waiting from about 2 to 5 minutes until that's the contact time, then dryness, then making environmental cleaning, okay. What about cleaning and disinfection of the environmental surfaces? Okay, disinfection for to control the environmental cleaning, we should have a schedule for cleaning, and we should make routine cleaning and disinfection for the environmental surfaces should be included as a part of the infection prevention daily activity. We will check the schedule. The schedule should contain the all items needed to be cleaned, and the frequency and the material used for cleaning and disinfection. Cleaning is very important step in the cleaning and disinfection, because cleaning removes a large number of microorganisms from the surfaces and should always precede disinfection. We have a rule in infection control saying that not clean, not sterile. Okay, more concern about highly touched surfaces, and we should differentiate between items for housekeeping surfaces and items for nurse surfaces. Okay, follow the manufacturer instruction regarding the amount and the dilution, the contact time, and safe use and disposal. For laundry, to safe handling textile and laundry, a linen sheet placed on the mattress is not considered a mattress cover. Okay, take care from this issue. Mattress covers should be replaced when torn, when the mattress should be replaced, and the mattress should be replaced when it is visibly stained. Healthcare personnel must practice the hand hygiene before handling any clean linen in order to avoid contamination of the linen, and it should be separated from the contaminated one. Linen from isolation room is considered regular soiled linen. No need to put it in yellow bags, as it's considered wrong. Okay, linen that contaminated with blood or body fluid, it should be placed in water soluble bags before blue one. Okay, now regarding the learning moments, I need you to know, number one, what is the standard precaution? It is a precaution applied to all patients, especially hepatitis B, hepatitis C, HIV, okay, bloodborne pathogen. Number two, hand hygiene. What is the surveyor will ask you about hand hygiene? He will ask about the technique. You should demonstrate and technique. The technique, the important issues in the technique, we should know the steps, okay, and the time. Consider the time. He will count in himself. Okay, number two, regarding hand hygiene, I need you to know what is better, hand wash or hand rub, and what is the situation you should do hand wash on it. Number three, I need you to know what is the 5 moments for hand hygiene. Regarding PPE, I need from you to know that what is the order for donning and what is the order of donning. What is your size for N95? Is this size is available or not available? Okay. But all this issue is important regarding PPE. Regarding waste, I need you to know what is the type of waste and what is segregation. For example, when you will check the black bag for the general waste, how you check it for what is how will speak about waste segregation. If he checks the infectious waste, he will also check the waste segregation. But when he checks the sharp container, he checks for 2 issues. Number one, looking for recapped syringe. Okay, that's considered not an unsafe injection, and he will check for segregation. What is the type of waste inside the sharp container? It is not accepted that to found gauze or cotton or plastic cover for infectious for syringe. It is not accepted to be found in the sharp container. One of the important issue, you should know what is your responsibility regarding items received from CSSD. You should know your responsibility regarding receiving linen, and also your responsibility regarding send contaminated linen to the CSS to the laundry. One of the most important issues, you should know where is the policy speaking about this. Okay, for example, the surveyor will ask you where is the size for where is the policy for hand speaking about for hand hygiene? What is the policy speaking about isolation precaution? Where is the policy speaking about waste management? Can you open the policy regarding waste management? Can you open the policy regarding PPE? That's very important. You should know where is it and how, and he will count the time expended for you to open the policy. Okay. Thank you. I hope you are get benefit from this one. Thank you.